Welcome back to the Cruise Elite podcast. In today's episode, I have a conversation with Shaun Puro. Shaun is one of our members. He's also a chiropractor, and I've been really excited to talk to Shaun so that I can find out more about how he's been integrating the material that he's learning from the Neuro Dojo into his chiropractic practice. He shared with me multiple stories at this point, and he's having tremendous success. So I wanted to hear directly from him, and I wanted him to tell you guys about the experience because he's doing great things. Let me tell you about Shaun. He's a super nice dude, and he is an incredible member of our community. He's always cheering people on. He's always cheering me on. He's always a pleasure to talk to. So without further ado, here is Shaun and I talking shop. Shaun, what's going on, man?
How you doing? Excited to be back.
Yes, I was just about to say this is groundbreaking because you're the first person that I've interviewed to now come back to the podcast for the second time. So that's your title right there, man.
Oh man, heavyweight champion of the world.
But I wanted to have you back then for obvious reasons. I mean, the first podcast that we did together was great, and we talked a lot about you personally and how you found Cruise Elite through our initial free mobility challenges and how you applied that material to your own body and gained some really amazing things. And today what I wanted to talk about is how you're using the material that you're learning in our membership platform and through our Neuro Dojo course, how you're using that professionally because, well, you are a health and movement professional. And I just wanted to give you some time to talk about that. And we'll I want to hear more about how you're using the material and even some stories if they come up of client cases, patient cases that have been exciting for you. So before we get into all that, let me have you just kind of reintroduce yourself to our listeners. Can you tell us, what your role is professionally, where you're practicing, and what you're doing? Because I know that when you explained your different tool bag to me of things that you do, you are titled as a chiropractor. Is that correct?
That is correct.
But you're doing a lot of different stuff, and I'd love for you to just kind of explain what those things are so that people can get a sense for the kind of practitioner that you are.
Yeah, so my name is Shaun Puro. I work in Roswell, Georgia. I work in an office with my father-in-law and my wife, and my father-in-law has developed and invented his own chiropractic technique. So right off the bat, we have been doing things different than the traditional chiropractic way. So in layman's terms, it is hard to explain to someone what we do. It's more about coming in and understanding the cause to why they are feeling the way that they're feeling. And we always hear this from our patients that we tell them things that they've never heard before, because when they go see a chiropractor or a physical therapist or an ortho, they only look at the local area and they don't look at the big picture. So we draw a huge picture for them, the big picture, for them to understand the cause to their trouble. So we're able to measure their postural misalignment through a postural measuring device that my father-in-law invented. And it tells us a lot of information, a lot of data on how the body is breaking down and collapsing. And what's interesting about that is I understand it on a total new level through what you have taught me and the reasons why people respond well to our type of corrective care and the reasons why they don't respond.
Oh, that's great.
Yeah, it's unbelievable. And it's amazing to see how the neurology affects a person's postural tone. And we would use that information. We would deliver a different type of adjustments through the upper cervical area, which is the upper spine of the neck. And we would deliver an adjustment to release any type of fascial tension through the body, and through the mechanical engineering practices of my father-in-law. and background, he was able to understand the best mechanical leverage is through the upper cervical spine. But
Mm,
upper cervical traditionally looks at the C1 and C2 vertebra as the biggest subluxation to cause postural distortion. But if we follow the laws of physics, big things move little things, we start to understand what is the first thing that touches ground, the feet. So we look and
yeah.
see how the feet, the knees, the hips are thrown off of alignment. And then neurologically, how does the rest of the body compensate to that postural distortion? And we're able to measure that. And we use that information to deliver the adjustment. And then we are able to reassess to see if those numbers have changed.
Wow, that's really cool. That's really
Mhm.
cool. So what are the actual tools that you use? Well, I guess let me ask it this way.
Mhm.
How did you practice before you got involved with our platform in the Neuro Dojo? Because I'm kind of curious, like, what your initial tools were, and then as we kind of talk today, I want to hear about how the lens that you're looking through has kind of changed because of your knowledge now with applied neurology. So, like, what were those initial tools?
Yeah, so the initial tools that I used was I would use Graston, I would do arthrokinematics.
Hmm.
I would also use different types of kinesiotaping, post-isometric relaxation techniques, um, joint and muscle reeducation. I would utilize selective functional movement assessment as an assessment tool to see whether a person has a mobility or stability issue. And then from there, I would address the mobility issues, and then I would use exercise strategies to re-educate the system so that way the quality of their movement improves.
Dude, don't you find it funny that there are people out there who are like, chiropractic is fraudulent and doesn't work and it's literally made up. And I'm listening to you talk about what you're doing and how complex it is and how many tools you have in the toolbox, and I'm like, no, this sounds like ninja stuff. like like
No, I get it. I get it. I get it. A lot of the techniques and the strategies that I've applied are things that I've found success personally. When I
yeah,
was struggling with my own body, I was at a crossroads and everything that I was doing didn't seem to help. So that's what led me into the functional movement world. And once I
right.
got into that world, it just opened up doors. Your
Yeah,
focus your attention and your focus isn't there until something shows up. And then when it
right.
shows up, it opens up the door to the next thing, to the next thing, to the next thing until I get to you.
Yep. And so this is, so I think we have a lot in common in the fact that we both were in a place where we're like, well, this can't be the end game because we're not satisfied with the results that we're getting.
Right. Because
Right.
some things would work and some things wouldn't work. And I didn't have an explanation to that. I would
That's
tell my
exactly how it was for me.
I would tell my patients, listen, it's gonna take time. It's gonna take time, but over time we wouldn't really see a change. I
Right.
mean, they would be feeling better, but I wanted to do more than just feel
Right.
better, you
Yeah.
know?
Yeah. That's how it was for me. So, I'm not a chiropractor, but as a coach in a personal trainer, people would come to me kind of. These are the folks that sort of live in the gap between being too healthy to need some kind of health care. They're trying to take care of themselves. Things hurt. They're not moving the way they want to. They have aches and pains, but they're not able to get any kind of diagnosis necessarily on that because they're quite healthy, but they're not where they want to be. And so I was always dealing with a lot of like post rehab type um, you know, cases and clients early on in like the first generation of my career. I was just taking them through what I thought was healthy exercise.
Mhm.
And it really bothered me because I'm like, all right, well, I think what I have them doing is good, but am I going to see the result that we're hoping for in, 12 weeks, right?
Right.
And it was always frustrating to be like, yeah, I guess we'll wait 12 weeks without like knowing if we're practicing the right stuff.
Right.
And yeah, sometimes things work themselves out, and I looked like I knew what I was talking about. And other times it's like we weren't even close. And for me, when I started getting more involved in applied neurology. It was the paradigm shift. And I know that you've had that same paradigm shift.
Mhm.
And it's been so cool to hear that about that experience. So what I want to talk about real quick before we get into some of your professional success here with different cases, let's kind of, just for our listeners, give them an idea of how you found me, and our programs, and that'll kind of lead us into more nerdy technical talk.
Yeah, right. So initially I was dealing with some hip pain, and I had followed you on Instagram, and I kept watching your videos, and I loved the neurology, the anatomy, the physiology, all the information that you were presenting to us was on point. I just didn't know how to apply it for myself. I didn't know how to apply it to my patients because I
Mm.
didn't have the education yet. So when you offered the hip mobility challenge, I said, I have nothing to lose. I'm going to give this a try. And it was more than, what I was expecting. And what
Right.
I started to do was I started to not only apply it on myself, but I started to apply it on certain patients
Mm-hmm.
because I wanted to be very comfortable and clear with the information before I could even present it. Because I just want the best for my patients, and I want to make sure that what I'm doing is on point and on target.
Right. Right. And so through our mobility challenge and then getting involved in our membership platform, you found the Neuro Dojo,
Mhm.
right? And just so our listeners can be clear on that, the Neuro Dojo is separate from our main, membership platform. It is a specialty course where we go much, much deeper into applied neurology that can be used to help people get out of pain and to help people fix movement problems. And it's for not only health and fitness professionals, but really anybody who considers themselves a lifelong student in terms of improving their health and their movement. So Shaun found the Neuro Dojo, and what I wanted to know, Shaun, is when you found the Neuro Dojo, like, what were you thinking, and were there any initial obstacles for you in that thinking? Because I'm sure you like wanted to jump right in and do it, but it's a commitment in a lot of different ways, and I just kind of wanted to hear from you what you were thinking when you were in that deciding phase to take the course.
Yeah, so I was really excited. I was very excited to join because I'm a forever student and I love learning. And I knew that if I didn't take this opportunity now, that there would be a lot of information that I would miss out on. And what motivated me was to better myself, but also better my patients.
Right.
At times I was overwhelmed because it is a lot of information. It's a lot of information that you have presented, but in a way that was very organized. And
Mm-hmm.
and I like that you kept bringing it back to us, telling us focus on these things and don't get overwhelmed with all the information because
Right.
you were always trying to make us understand that this is going to be a process, not just learn everything in one day.
Right.
And once I got that in my head, I started to realize that this is a process, and I have plenty of opportunity to practice the material on myself as well as all my patients. So that's what gave me the confidence to be all in.
I really admire that about you, because from the beginning, you always had the courage to try things. And I think that's such an important part of the process, because it's easy for somebody to feel like imposter syndrome,
Yeah.
right? I feel like everyone goes through it at some point. I kind of was in that place at one point when I was learning a lot and it became overwhelming. But I always pushed myself to have the courage to apply the material, because I knew that no matter what, it was okay if I wasn't right. You know what I
Mhm.
mean? Like, it's
Right.
okay because you can just try the next thing. And I felt a little bit self-conscious at first because I didn't want my clients to think that I was just sort of experimenting on them. But then it's really interesting because they actually loved it and they supported me in it because they felt like they were getting the support that they actually wanted, right? I was like listening closely. I was trying to apply new tools. If it didn't work, I didn't get overwhelmed. I just marked my findings and moved on. And what started out as like feeling self-conscious about it ended up being why people came to me and stuck around. You know what I mean? You're
Yeah.
nodding your head. Did you have a similar
It's
experience?
Oh, without a doubt.
Yeah.
Yeah. So I felt that it was a guessing game, or that's my that was like what I assumed was happening, that patients were looking at me like I didn't know anything, and it
Yep.
was really in my head.
Right.
And I also loved when you would tell us that if you these findings, no matter what, no matter if they're helpful or not, it tells us more information, it gives us more data. And that's what I loved about that. And I communicated with patients about if something didn't work, that's okay.
Right.
It gives me data. I'm going to mark it down and we're going to try another approach. And the best part is we're always able to return back to the certain drill or certain thing that wasn't beneficial or helpful. And that was an assessment in itself, because once we started to see improvement in that, the patient was like, oh my gosh, I remember that this particular drill gave me a bad assessment and now it's a good assessment. And they would get
Mm,
excited because in their mind, they can see that they're actually making improvements.
yeah. So Sean, you mentioned before that you had good tools to begin with, right? You were doing good things for your patients, but you mentioned that you weren't 100% confident in their or understanding why things were working or why they weren't working.
Mhm.
So what I am kind of curious about is how are you viewing what's happening in your practice now? Like what has changed, because you obviously have this new lens to look through. How is it impacting the way that you practice?
So the organization of my practice has changed significantly. I've been able to put a patient in their perspective category based on their symptoms. At
Mm-hmm.
first, I would take an in-depth case history to understand what's going on, but then I would apply the strategies that I've used before without really understanding the neurology behind what is going on and how
Right.
I can help this person. So um, the fact that I'm able to organize these categories and place these patients in them, and this is all provided through the Neuro Dojo, and I'm able to understand a roadmap of where to begin. And
Mm-hmm.
that is huge and critical for me.
Yeah.
Because before it would be a one size fits all model
Right.
where someone has a mobility dysfunction of the hip, we're going to start there. And I had no way to assess and reassess and understand if what we're doing is actually working. So I'm able to now place a patient in their respective category, and from there, it gives me a guideline to from a start. And from there, we start to assess and reassess, and then we start to move on to like the next things that are needed. But the first thing that we address are what is all signs pointing to help this individual.
Yeah, yeah. Starting point is so huge. So, could you have an exciting story that you could share, a patient case that, just one of those stories that's like gets you fired up, because
Yeah.
of the process and how it went, and if you could kind of tell us, what your thinking was going into this, what you guys did and what the outcome was.
Yeah, so I had this one patient and she is unbelievable. She really is. She's been a long time patient, but she's one of those patients that's willing to try anything. So she was under our care for a while. She was maintenance and she kept coming back with the same thing. She had bilateral rib pain. So anytime she would take a full breath, it would be a burning sensation, some tingling. She would have facial tingling and burning. She had symptoms in her fingers on both sides that were numbness, tingling, sometimes burning. She would have severe neck pain. So she's the type of patient that would go on these Facebook groups with her diagnosis. I think it was like
Mm-hmm.
degenerative disc in her cervical spine. And she would start talking to all these patients that have had them and their stories, and it would all point to surgery. So they kept trying to convince her that surgery was the only way out. And she was
Right.
afraid of that.
Hmm.
She didn't want that. So I sat down with her and I talked to her, and was perfect timing because I started to work with you. And I started to tell her about I'm on this new journey and education of understanding and learning how I can help you, but it's going to require some commitment and some care. And I promise you that in a year's time, you're going to be so much better. And she said to me, if it can prevent me from getting surgery, I'm all in. So the first thing that we started to do was I wanted to start talking to her about the threat elimination
Hmm.
phase. So we started to identify some things that were threatening to her nervous system. And a lot of these patients, which is wild, I would find out that they would do their activities, a full day of activities, especially in the morning before it got hot, and they wouldn't even eat. And that to
Yeah.
me was something wild because as a chiropractor, we're supposed to encompass holistic care. So if we're going to talk about holistic care, we want to start at, covering the base of true health.
Yeah.
So just by that, by her um, implementing those strategies, that seemed to help in itself, which was great. Okay, so that
So
would
so like fuel type stuff.
fuel type big
Yeah,
time.
because
Yeah.
for me too, that's the elephant in the room for me, to be honest with
Yes.
you. People get on calls with me, we do one-on-one work, and then I find out that they don't have good nutritional habits
Mhm.
and they don't know the basics. And it's kind of like, oh man, like what like how like we can't necessarily do everything. We can't use all the tools that we know how to use knowing that the fuel capacity might not be optimal,
Mhm.
and it presents some challenges, but that's so important at the beginning to kind of put that out on the table for people.
Absolutely. And the best part is when you experience something like that yourself, because I had a fuel capacity issue myself.
Hmm.
And once you experience it and actually change a little bit of your lifestyle that
Yeah.
meets those fuel demands, then all of a sudden you start noticing you do start feeling better.
Yeah,
And
it's huge.
it's incredible. So we started to implement that, and then we started to utilize an assessment, a range of motion assessment that was non-threatening, non-painful. And once we were able to identify an assessment, we started to perform some drills. And the first thing that I wanted to address with her was her breathing, because once I started to notice that once I assessed her breathing, and I actually performed the CO2 tolerance test on her.
Oh, nice.
So I recorded all of that and I realized that her breathing was significantly impaired.
Interesting.
So I knew from that
Another for a form of a fuel problem.
absolutely,
Yeah.
absolutely. And she heavy neck breather, heavy chest breather, no expansion in her lower ribs, and that was exactly where her pain was.
Hmm.
So we started to implement some breathing. We did diaphragm stretch, supine diaphragm stretch, and we noticed that that was actually a threat,
Hmm.
which was interesting.
Yeah.
So we even tried to implement it better, and it was still a threat based on our assessment. And and I took a step back, and I wanted to continue implementing the breathing. So we started to do just easy diaphragmatic breathing,
Yeah.
this expansion. So no arms over the head, no reach, just learning how to expand. I even put a band around her lower ribs and I had her focus on hitting the points 360 degrees all the way around.
Nice.
And once we were able to implement that a little bit, she started to identify that there was some lag, that she didn't feel like she was getting enough expansion into, I believe it was the right back corner of her
Hmm.
lower ribs.
Hmm.
So I focused her attention on that and we started to implement that. So we did literally a whole session on this particular drill,
Yeah, nice. Like, so you're talking the 3D, like the
the
3D
3D
band
band
breathing,
breathing.
basically, that we
Yeah,
teach, and you were kind of biasing it to that more restricted side.
exactly.
Yeah,
Exactly.
beautiful. That's cool.
Yeah. And before we continued, we also reassessed to make sure that it was safe and effective, and it was.
Nice.
Yeah, and so we started to implement that, and she came in that day, with severe symptoms, like lying on her back was producing her facial symptoms.
Oh,
So we couldn't perform it lying on her back, but we perform it seated. we tried it just seated. So that way she could stay relaxed, stay calm, and we just tried it that way. Um, the standing, for some reason, was also aggravating her symptoms as well. So the only position that she can perform this was seated. So we did that, and then we reassessed. She got a good assessment, and then we just evaluated how she felt lying down on her back.
Hmm.
So when she lied down, symptoms gone.
Nice. So the retest was the position that was bothering her initially.
Yes,
Cool.
yes.
Cool.
That was unbelievable. It was just, when you see something like that in real
Yeah.
time, it's just
Yeah.
unreal.
From a
You're,
single drill
yeah,
that was approached the right way. I mean,
yeah,
that's the whole name of the game right there, right? It's instead of turning all the screws, turn the right one.
exactly,
Yeah,
exactly.
and that's awesome. So was she pumped up at that point?
Oh, she was so excited. She was excited. She's like, I can't wait to get on Facebook and write to the group, and
Yeah.
and she would come back and tell me, this person said this on Facebook, and she would start laughing. She was like, well, they're obviously not seeing the right chiropractor because my chiropractor does amazing things because all these people on the in the group, they would convince her or try to convince her that chiropractic care is horrible for their condition.
Oh,
And
interesting.
she wouldn't say anything. She would just say, like an easy comment, not my chiropractor, my chiropractor's the best, and leave it at that.
Yeah, yeah.
You know. So we started to work on moving the spine. That was the next thing that we wanted to focus on, and that was the second session when she came back.
Hmm.
So what I also like to do is when I see people move their joints, I also use that as an assessment tool as well, just to see how well their map is.
Yeah.
If their map is blurry, they're going to have, lack of coordination. They're not going to understand how to perform the specific task. They might notice that one side of the spine moves better than the other.
Right.
And then we could also notice big compensation factors in the way that they move incorrectly. So we started to address that. And the one area that I wanted to start off with was actually the opposing joint of the neck, because anytime we move the cervical spine, that was a big threat.
Ah,
So we started to work on pelvic tilts.
sweet.
Yeah. And the hardest part about that is everybody knows how to do a pelvic tilt, but when we are targeting the sacrum,
Right.
it is one of the hardest things
Super
to get
subtle.
people.
So
Yeah,
subtle because everybody
exactly.
just kind of wants to move in their lumbar spine.
Exactly, exactly. And the
Yeah.
problem is with people that we've worked with and we were doing, mobility drills like pelvic tilts, it was all lumbosacral movement.
Right.
So then we had to train them out of that. And it took some time. Some people got it right away, but then most it took time, and that's okay because I knew that the things that were hard and difficult are the things that people need to work on the most. And once they get it and they have that light bulb aha moment, it's amazing and how much control they have. And some people it can take weeks, some people months. I mean, it
Yep.
takes
Yep.
time.
That's right. That's right. Okay, so opposing joints. So the neck was the painful area. It
Yep.
it it wasn't allowing you the entry point that you hoped for.
Right.
So your mindset went opposing joints, which is awesome because that's a great tool. So you hit the opposing joints with pelvic tilts. All right, cool. So what happened there?
So then we got a good assessment. And she started to know. And then the first visit, we couldn't use neck rotation as one of her assessments
Uh huh.
because that was painful. She could do a forward bend, so her forward bend got better, and then we could do trunk rotation because that didn't aggravate, and that got better. So that's where we started.
Nice.
Um, after we did the after we did the pelvic tilts, then we reassessed her neck rotation just to see how it went. She still was restricted, but the pain was gone.
Oh, sweet.
Yeah.
Very very good.
So there we go. We're starting to build a program for this patient. So we have some breathing. And on this visit, we actually tried diaphragm stretch,
Hmm.
and it actually worked beautifully.
Oh, nice. So
Yeah.
that's a huge indicator of success when you can go back and revisit those initially threatening drills and now they're not threatening.
Right.
To me, that's a really exciting moment because it's like your client is building this foundation and their threat bucket is getting bigger and they're able to tolerate more threat
Right.
in the bucket and functions improving, I think that's a huge indicator of success.
Absolutely. Absolutely. So then we continued working on the spine, and we started to implement thoracic glides, and that was very difficult for her. A lot of compensation.
Yep.
It was exacerbating her rib pain. So I took it one step further and decided to try front wall assisted lumbar circles.
Nice. I just taught that yesterday on our call for the for Neuro 101. I went through like lumbar wall supported lumbar
Yeah.
circles and then the whole thoracic series.
Yep. I love that. It's one of my favorite drills. I do it
For
every day.
sure. Yeah.
I really do. So we did that, and she loved that. It felt really good. She even said her doing it, her neck felt really good. And I had to teach her to keep her neck relaxed. I had to make sure that her jaw muscles were relaxed, her tongue was in the right position, she
Yep.
was breathing, we were slowing down our movements. And I love how you talked about I believe it's the um the shape continuum,
Yeah.
if I'm not mistaken.
Yeah. Yep.
So circles, figure eights, brain loves them. And sometimes people need to function in a line or a dot, right?
Yep.
So this particular patient, to me, I turned a lumbar front circle into a line.
Perfect. That's cool.
So I had to pause on each motion of that for her to understand exactly
Yeah.
what we're doing, because there would be times where she was just whipping her body around.
Yeah. Yeah. Just kind of lost in space trying to do the lumbar work. That's great. That's
Mhm.
a perfect reason to scale it back. I love it.
Yeah. So 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 I sent her home with breathing drills. I sent her home with the pelvic tilts. I sent her home with the lumbar front circles. And that's where so for that week, that's what she was focusing on. And then we came back, I reevaluated her movements, making sure that she was hitting the target. And the one thing is, I tried not to overcoach, and I also sent her your videos, which is great because you do a great job
Sweet.
explaining. So she's always watching them and
Nice.
performing, and I could see that her movement quality is getting better and better and better, which I'm really happy about, and her symptoms are doing a lot better as well.
That's great.
Yeah.
So
So
she must be feeling a lot more hopeful.
I'm very hopeful. So I've been working with her like this for a year now.
Hmm.
So we've managed to mobilize um, every single joint in her body.
Yeah.
And it's amazing because things show up. Things show up. She'll
Yep.
come in, feel her symptoms are feeling good, but then she might develop knee pain. And I'm thinking to myself, this is a great opportunity. Let's
Yep.
take a look at the actual joint itself. So we looked at, for example, single leg knee circles. And then we also looked at the joints above and below just to
Yep.
see what her assessment would say. And also, we use her knee pain as an assessment tool to see if it was making it better, worse, or stay the same.
Yep.
So that way we knew that we were hitting the target.
That's awesome. So it's so fun to have clients that are willing to be in it for the long game,
Hmm.
because at the end of the day, we want to construct these drills for people that fix all their problems all at once, but realistically, that's not really going to happen.
Hmm.
And it's just great to have people that are committed to the process because it takes work.
It
It
does.
takes work, and it takes a shifting of your mindset, especially for someone like her that was on like support groups and stuff, hearing other people's stories, and you want to find that support and find people that are going through a similar experience, but it can kind of work against you, can it? If it's not the right form of support that's motivating you to keep fighting the fight.
Right.
I think that's I
Absolutely.
think that's awesome that she found you and she was willing to be open minded, take a risk, and keep working.
Yeah, absolutely. I mean, this program is amazing. It gave me the confidence, the Neuro Dojo, especially the confidence for anyone to come into my office. I feel and I know I can truly help them.
Yeah.
And it's all about you involving them, getting them involved into their own care, and at times it was hard because in my office, traditionally, people expected to come in and lay on the table and for me to do all the work.
Yeah.
So now my body is getting beaten up because I am working, lifting these limbs, moving, every part of my body just to help this individual. And I would come out of the office at the end of the day feeling trashed.
Yes, and it's not a fair trade, is it?
No,
Because
it's not.
it's the wrong mindset for the individual, and I think that's such a huge problem in the culture right now because there's so many different therapeutic interventions available to people. The way that the average person thinks about it is they go and seek out the therapeutic intervention where maybe they lay on the table and the therapy is applied to them and they don't have to do anything.
Right.
And I think that even if it's an accident, they put all their eggs in one basket and they sort of expect that somebody else is going to do it for them.
Yeah, and I've lost some patience
Yep,
with that, and that's okay. It happens.
it
It
does.
happens. But I did my part by educating them and making them understand why we're doing what we're doing. But if they wanted to go to a place where they could lay on the table and the practitioner does everything,
Yeah.
that's on them. I
It
can't
is.
force
It
anyone
is.
to do anything.
And a lot of that has to do, yeah, with the person's education and really being in the right place with their mindset to accept what it's going to take.
Right.
Because some people they're not ready for that,
Yeah.
right? Because it's a big commitment, and it might have to be they might have to put a lot into changing their thinking and the way they're approaching things. I mean, I've had that happen to me too, where people just weren't ready for that. But as we were saying, the majority of people they there's not a whole lot of people out there getting great results like when it comes to pain. Like
Right.
there's not like it's a journey, right? And there's so much missing, right, in terms of what people know, and it's not necessarily their fault. It's the way that our society's kind of set up where, we're just sort of thinking, well, if this hurts, can I just pop the Advil? And then people go and they want to treat the therapeutic intervention that way.
Right.
So it's tough. It's
Right.
difficult, right? I'm
And if
sure
you,
you deal with that constantly.
yeah, if you could put a name on it, you could sell it, make a
Yes.
profit. But I love that we can use that to our advantage because everybody has a percussor. So they
Yeah.
can bring in a massage gun and I can show them whether or not what they're using is safe and effective by using their assessment. And it's amazing because the people that I've worked with, they bring in their massage gun and they start working on themselves with it. And then we reassess and it actually gives them a bad assessment.
Yep.
I've even used the Graston instruments that I've applied to show these people when they would come in and they would have a problem with implementing this information. I would tell them, okay, let's just see how beneficial this is for you. So I would apply the Graston instrument, do a pre and post assessment, and those patients actually worked out where using the instrument on that particular body part they wanted me to work on was actually a threat to their nervous system.
Yeah, I've done the same thing.
Mhm.
It's a huge educational moment for them
Mhm.
to see that, it's almost like some people don't want to buy in until you make them worse. And
Right.
they're like,
Right.
wait a minute, how did I get worse? Especially when I work with athletes. A lot of the time, athletes are like that. It's like, we do a drill that, I, racked my brain to figure out this, neuro stack for them. We do it, and their range of motion improves, their strength improves, their pain is less. And I'm like, nice, high fives. And they're like, I think the reason I'm getting better and my pain is less is just because I'm getting warmed up. And I'm like, okay. So then we're go through the process and we do a drill that makes them worse.
Right.
It's not until they get worse that they buy in. They're
No,
like, hey, why'd
absolutely.
you make me worse, man? Like, I don't want to be worse. Can we go back and do the high payoff drill? And that's like a moment, right, where people
Right.
they learn that not everyone responds equally to the same stimulus. I
Exactly.
had an experience years ago. It was kind of a oh crap moment because it was early on when I was starting to apply a lot of this material, and at the time I got involved in using more markers of like internal health and like vital signs as a possible way to check in on a person's threat levels. And I would do this with really, excuse me, really difficult clients who were essentially having fuel problems very chronically because they're challenging. You do a drill, it might be great. Then maybe in session, that same drill fails to help them and maybe even makes their symptoms worse. Or sometimes with fuel based issues, you find the right routine to do the right exercises, but in a few days they no longer work and they might even make the person worse. And it's that person's, internal body expressing some level of chaos and threat. And so it can be difficult to tame that chaos in session and to have an assessment approach that shows you what's actually happening inside.
Right.
And so I learned about using like a perfusion index monitor and just popping it on their finger and watching their heart rate and watching their oxygen saturation and their PI, so that you could get a sense of like what was happening with circulation. And it was an oh crap moment because I was working with a woman who was super dedicated to the process, great to work with, ready to try anything. But her biggest obstacle was that she kept getting the drills that helped her eventually became threatening drills
Okay.
because of the fuel problems.
Right.
And she was a person that, because she was so uncomfortable most of the day, she was constantly foam rolling.
Hmm.
And so one day I was like, hey, let's kind of see how this foam rolling is affecting you, because you're saying to me that you're doing it every day, multiple times a day. We really should check it out and make sure that it's good for you. And so I put the PI monitor on her finger, and we looked at her oxygen saturation and her perfusion index. Which, like, I was looking at the perfusion index because it's a good indicator of sympathetics. So like a really low PI would kind of indicate becoming a little bit more sympathetic, a little bit more stressed out. A more normal PI, as that number gets higher, just tells you, things are in better balance. Maybe we're moving more towards parasympathetic state. And so anyways, we took the PI, things were in a reasonable place. She started foam rolling, and she started foam rolling for like, I don't know, she did like maybe a minute routine. Like she's like, okay, I do this, I roll my quads, I roll my this, that, the other thing. And then she stood back up and I popped the PI monitor back on her finger, and her perfusion index had dropped all the way to like 1. And I was like, that was like a moment for me where I was like, man, this is crazy, because her body is so stressed out from what she's doing. It's like metabolically, she can't handle the input that she's providing herself.
Yep.
And then something that actually feels good to her is actually stressing out her system. And this is probably what's happening with so many of the drills that we're applying.
Uh-huh.
And so it was like a really big moment for me to start to understand that if your client isn't metabolically healthy enough to handle what you're doing, even the right drills don't work for very long.
Right. And I see
Yeah.
that all the time. I
Yeah.
do see that, where people are drilling and their assessment is giving them a negative read. And,
Right.
it always goes back to fuel capacity
Yeah.
and their metabolic health. And that's what I started to implement too with the patient that we were talking about. Once I started getting into the neuro dojo, I started to evaluate her gait. I just wanted to see how her
Nice.
gait was. And I noticed that she could have potentially had a bilateral PMRF. So then I also did a cerebellar assessment on her.
Mm-hmm.
I took her blood pressure. So she got the works that day.
Nice. Nice. What kind of things
Yeah.
were you finding from that from those assessments? Like, were you starting to pattern her?
Yeah, I did start to pattern her. I noticed that she had actually a bilateral cerebellar issue
Mm-hmm.
and a bilateral PMRF.
Makes sense, being a person with spinal pain.
Yeah,
Yeah, that's interesting.
and it's amazing when I found that, I started to realize that what I was doing with her was beneficial. So
Yeah.
we started to move away from the spine at that point,
Mm-hmm.
and then I brought it back in.
Yeah.
So let's go back and see. And then we started to notice that her control of the way that she was moving her spine was becoming deficient again.
Mm,
And her pain,
interesting.
and interesting enough, at that time, that's when her pain started to return. And the stuff
Interesting.
that she was doing wasn't helping.
Interesting. Have you done any vision work with her? I was just curious.
Yeah, so then I started to implement some visual stuff as well. We
Cool. Was
started
she sensitive to vision drills, or was she okay with with doing them?
she was sensitive to some of the visual stuff.
Yeah.
Yeah.
Yeah, I
Yeah.
was just curious because I've seen that too a lot with people with like cervical spine issues, and
Hmm.
they can have a pretty small tolerance for the vision work, but it can be a huge player in the success because the working with the eyes and the inner ears is such a strong midline stimulus too.
Absolutely. Yeah, and we
That's really
tried
cool.
different simulations as well. I went down the list. We tried smell,
Yep.
accordion, and then just trying to see what would be the best payoff, the highest payoff. And once we found that, then we started to implement that. Just recently, I started having her do thoracic glides with her percussion gun. We haven't tried that yet. And one of your podcasts that one of your classes that we went through with the sensory stuff,
Yeah.
it's amazing because it just came back full circle. It's like, why haven't we tried that yet? Just give
Yeah.
it a try. She has a massage gun. Let's give it a try. So we did that, and she got a significant read on her assessment.
That's cool. I've got
Yeah.
a really cool one to share with you. So this is something I'm excited about because it just happened the other day. Um, I was working with a woman who I've worked with years ago, but we hadn't worked together in a while, and she had all sorts of challenges in the time that we were apart and not working with each other. She actually ended up getting to a place where a bilateral hip replacement was really what she had to do just to get quality of life back. And so she did that, and for over a year she was doing tremendous after the surgery. And she's currently a yoga instructor, and she was able to get back into teaching yoga. And she's very physical, very strong, very mobile. She was a an ex pro athlete, and about maybe almost 2 years later, she started getting similar symptoms to what she initially had before needing her hips replaced. So it really started freaking her out. And she contacted me, and she's like, "Hey, maybe we could look at some neuro stuff and see if I'm missing any, any important things, and we hopefully we can affect this pain." And I got on a call with her the other day, and she was telling me that she also had a spinal fusion. So it was getting pretty serious. She had an L3 that I actually don't know the proper terminology. Maybe you can help me. I think what they were saying is the L3 had become so unstable that she was actually at risk for a spinal cord injury. So she showed me her MRI, and L3 was basically like, I mean, I'm not trained to read MRIs, and I could look at it and I'm just like, oh, that's not supposed to be there. Like her L3 had like slipped forward,
Mhm.
like in its position. It was like gliding forward, and it was intense. And they were looking at it and they were like, "We this is scary." It was pretty. Is there a terminology for that with the vertebrae?
Like the vertebrae anterior listhesis,
Yeah, I'm not
like
sure
like
actually.
a like a forward slippage of the
Yes, a
vertebra.
forward slippage. Yeah.
Yeah, so anterior listhesis. And then what you notice on the spinal cord, did you see that the spinal cord itself was pinched? Like it should seem uniform throughout the whole entire spinal cord.
Yep.
And if you see that there's like a black area, disc material going into the spinal cord, that's
Yep.
not okay.
Yeah, yeah. That is absolutely what was on this MRI, and it
Wow.
was so obvious to me. I was like, "Wow, this is crazy." So they were she was at high risk, and they ended up doing a fusion for her. And she's made a great comeback considering, and actually she was moving great considering, but her symptoms were coming back and it was freaking her out. And she was describing to me that she was getting a lot of left-sided symptoms, and she couldn't like engage her left side the way that she wanted to for different movement tasks, throughout her day, but also for her training, whether it was yoga or strength training. And she was describing it to me as like a reflexive stabilization issue,
Hmm.
because she was essentially saying, I asked her, I'm like, "Hey, could you get in like a leg press machine and feel like you could press a lot of weight with your left side?" Because she's very strong.
Hmm.
And she was like, "Yeah, I actually feel like I could do that, and my body wouldn't be that upset about it. Like I could probably just do that. And I'm like, yeah. So is the problem does it feel more like it's showing up in your day and in your movement in a very unconscious way, like you're not ready for it and it's affecting your stability? And she's like, yeah, that's exactly it. And it's a confidence issue. So long story short, we went through some initial tests and stuff. And the thing that she wanted to use as an assessment, because it was important to her, was being able to hop on her left leg, because she had lost all the ability to hop. And she used to be like a very powerful athlete. She played rugby. So it was really bothering her that she had lost that. So she had like no spring. She couldn't even jump. And we tried to do the assessment. She couldn't jump once. She just smiled and laughed, and she goes, nope. And that was her assessment, because she couldn't complete one repetition of hopping. Wow. I was like, don't worry, we can use it. Let's see what happens. So I'll fast forward here, but we started targeting the left side of her brainstem with different inputs, and we tried some vision stuff, and it was okay, but the result wasn't enough to like really give high fives over. So I started creating some drills for her that target the left PMRF specifically. Mm-hmm. And one of the first things that we did was sound stimulation in her left ear. And I had her put one of her earbuds in on the left, listen to sound, listen to music actually, and she would concentrate on that. And then we did a retest. After listening to sound for about 40 seconds, just some music playing in her left ear, and she was plugging the right ear, she put the earbuds down, stood back up, got on her left leg, and jumped 25 times.
Wow.
And I was like, dang, that's cool. And she was like smiling, and she was like, this is crazy. It's a lot easier. So we used sound stimulus in her stack, and it ended up being this cool little stack where we did sound in the left ear. We did a reflexive band load on her left side. Like it was just enough resistance to challenge her posturally. And then we started doing thoracic glides, right? The opposing joint to her lumbar spine.
Yep.
That was our drill. We put everything down, retested, and she could jump on that. She could hop on that left leg for essentially as long as she wanted to. And she was just laughing. And we were smiling and laughing about it. And she was like, this is crazy. So I was like, okay, there's your homework. And she actually messaged yesterday. I put it up in our Instagram stories, and she was like, this is awesome. She's like, I feel like just sound stimulus by itself has even decreased the weakness that I was feeling. She's by like 90%. She's now wearing an earplug when she teaches her yoga classes. She's plugging her right ear, and she said she's able to go through the class and she's less apprehensive and more confident just from putting the earplug in. So that's she's amazing. Just like, the brain's wild. I was like, that's cool. That's a cool one.
No, that's awesome. And I could relate to that, because the office turned into a what are we going to do next kind of thing. And people come in, they're like, so what weird things are we doing today?
Yep, exactly.
And I have my table all set up with all these different sensory tools.
Yeah.
Just to give it a try. And it's amazing what shows up. And when people, when you have mentioned that 10% of pain or discomfort or movement in efficiency is left, just by adding that right amount of sensory input into the nervous system, can help that 10% that's missing.
Totally. I actually, like, once in a while I get to know someone well enough on my one-on-one calls and stuff. I literally play jokes on them. I'm like, okay, today they're like, what do we need today? And they call it the Tailor Bag. So like many clients over the years have all said the same thing. They're like, I got my Tailor Bag. One athlete I was working with called it the Tailor Station, and she had this like plastic sliding drawer system on wheels that she would wheel around her gym at home. And like each drawer would have all these weird tools in it, like vibration gadgets and, vision targets and all this stuff that we use with people. But I'll play jokes on them once in a while. And I'm like, they're like, what do we need for today's call? I'm like, okay, so get me a paper clip, a paper towel. I need an avocado and a butter knife. And they look at me and hesitate, and then they start getting that stuff. Yeah. And then I'm like, they're like, hold on, let me get that stuff. And then I'm like yelling. I'm like, you don't need the avocado, by the way. It's like, but because it's become so like bizarre, what we find around the house to use for tools, we have a good time with it.
Yeah, people won't think that they won't think that what you're asking them is a
Yeah.
ridiculous thing because some of the
Yep.
stuff I'm sure to them has been ridiculous and they're like, why
Yep.
not?
It's
Yeah,
totally true. Totally
yeah,
true. So you really have to experience it, right, to
yes.
understand what Shaun and I are talking about. And this whole idea of applied neurology, it's essentially using the brain and figuring out what kind of missing inputs are needed to help a person move better and feel better. And it is so powerful for decreasing pain and improving movement. And yeah, sometimes the drills look silly and feel silly, but that's okay when they're actually doing what you want them to do. The last thing I wanted to ask you, Shaun, is do you have any advice for anyone who's on the fence about enrolling in our next cohort with the Neuro Dojo? What kind of advice would you give to someone who's wondering if this would be the right move for them?
Yeah, I mean, everyone can benefit from this. I feel that if you are a person that just wants to continue to learn and to improve yourself, the longevity, if you're all in it, for the long run, this is for you. For movement professionals, if you really want to elevate your practice and help people and never feel that you're in a place where you have no idea what to do or how to help the individual, this is the program for you. And then for people that might feel overwhelmed by the material, you might get that sense, but to be honest, the way that you put the program together, by the time you are done with the program, you feel so confident that you can help yourself and anybody that comes in your life. And you don't even need to be a movement or healthcare professional. You just will have a better sense of your body and the way that your body perceives your environment, and any question um, that shows up to you about why you're reacting this way or responding this way. It just gives you a sense of calm and peace to know that your body is just having a reaction to a certain stimulation, and you have the strategies and the tools, and you have more strategies and tools and better strategies and tools to help yourself. And it is a game changer, big
I
game
love it.
changer.
I love it. Well, dude, thank you so much for coming on the podcast. Shaun, I have enormous respect for you. I always got that sense when we first met and I started hearing more about what you're doing professionally that it was very obvious to me that you were working in such an ethical way, and how you weren't satisfied right
Mhm.
easily. You wanted more for your patients, and they're really lucky to have you. And it's just been awesome to watch you grow as a practitioner, and now to hear what you're doing utilizing this material. I love hearing your stories in the community page, and I'm just looking forward to seeing where this all goes for you.
Yeah, man, me too. This journey has been exciting and I'm glad to be on it. And I thank you for everything. Really appreciate it. All my patients thank you because, like I said, you are a household name in our office and in my house. And I appreciate you, man.
Thanks, brother. Thanks, brother. Well, listen, maybe you'll be back for a
I,
third time.
I'm ready to go, honestly. I feel like I have more to unfold. I've been helping so many people and just having so much fun, and it's been a blast. And I really appreciate everything that you've done for us.
Oh, thanks a lot, man. Great to have you on, and we'll talk to you soon. All right, there it is. Hey, if you want to connect with Shaun, I'll link his information in the show notes. And if you want to join Shaun and learn what he's doing with applied neurology, then you need to sign up for the Neuro Dojo. We only run this program live once a year, and now is the time. Each year, we refine the program and the price does go up. We begin the course September 4th, and you're going to learn how to assess and train higher order systems that will have a powerful impact on how you move and how you feel. And if you're a movement professional, this course, I promise, will reignite your passion for your career in so many ways. That's it for today. Thank you so much for listening.